may indicate if your therapy is working earlier than SPEP or IFE, and if your therapy is not working, it indicates that a different therapy may need to be used. It can also detect relapse earlier than the other diagnostic tests, and I'll show you some of the data for that. This is a patient with IgG kappa multiple myeloma. In blue is measured with serum free light chain kappa assay, and red is SPEP measuring the intact Ig. This is the axis, and you can see this is the axis, and this is time from presentation. So the patient presents and gets put on a therapy. And if you're measuring just by SPEP in red, you can see it's several weeks or many weeks before their intact Ig starts going down. But if you were to measure with the light chain, it drops rapidly. This shows how serum free light chain ratio can be a predictor of response to therapy. So this is kind of a complicated graph, but I'll go through it. I'll explain all the parts. Here's the percent of people responding either in complete response, near complete response, partial response, and so forth. And you can see that in cycle, well, you can barely see, in cycle 1 and 2, there actually aren't any complete responders. These lines are going up here. But as you go to cycle 3, 4, and 5, you see more and more complete responders. And what the researchers in this paper found was that normalization of the free light chain ratio after 1 or 2 cycles was highly predictive of achievement of the complete response or the near complete response, and this was statistically significant. This slide shows how serum free light chains can give you an early indication of relapse than immunofixation electrophoresis. Here's a serum free light chain concentration, and here's the months after the patient had a bone marrow transplant. Immunofixation is the open balls is where immunofixation is negative. The black balls where immunofixation turns positive. And you can see this patient's serum free light chain is rising even though their immunofixation is negative. And then the immunofixation turns positive and their free light chain continues to rise. What this means for this particular patient is if they got a 6-month early indication of relapse using serum free light chains. Another important reason to use serum free light chains is they've recently been recommended by the International Myeloma Working Group, and that is the group that Dr. McHale mentioned, he is part of this group. And this is recently published just this month, or just last month, and they said that serum free light chains are good for diagnosis, prognosis, and monitoring. For diagnosis, you can use serum free light chains, SPEP, and serum IFE, and it's sufficient to screen all plasma cell disorders except AL amyloidosis. If they think that you might have AL amyloidosis, they need to do the 24-hour urine IFE. For prognosis, the data is very strong in the article that serum free light chains are of major value for every plasma cell disorder. And then finally, for monitoring, they're recommended for monitoring AL amyloidosis patients, oligosecretory disease, which is a special category, and then importantly, patients with complete response to test for stringent complete response. And I'll talk more about that in the next slide. This is also from the International Myeloma Working Group. It's an International Uniform Response Criteria in Multiple Myeloma. This was published earlier in 2006. And free light chains are important for determining, as I mentioned, stringent complete response, also for complete response if some of the other assays can't be used, and also for partial response when some of the other assays do not indicate what's going on. There are some practical considerations for serum-free light chains that you should know as a patient or a caregiver. There is some laboratory variability with every test, and there is some for serum-free light chains. The absolute values of the serum-free light chains may vary from lab to lab, especially if your serum-free light you change your laboratory. So if you do change your laboratory, have the new lab split your old sample and your new sample and run it in the new lab. And then also you could also establish a new baseline for your serum-free light chain test. The important thing to remember is that change in the absolute serum-free light chain level should not affect the clinical interpretation. So in summary, I've shown you that there's new guidelines for serum-free light chains from the International Myeloma Working Group, and they've said that it's important for diagnosis, prognosis, and monitoring. I've shown you that serum-free light chains have been incorporated into the response criteria guidelines, And they also can give you a rapid indication of response to treatment. And they can also provide an earlier marker of relapse than immunofixation electrophoresis. So I hope this information has helped you better understand the test results you're getting or the test results you'll get in the future. And we're going to have some questions in the panel discussion, but I'll be around the rest of the day if you have individual questions you want to talk to me about. And we also have a booth with lots of literature, and we're happy to help you in any way that we can.